Hello, everybody. I'm Dr. Aradhya Achuri, fertility consultant at Apollo Fertility.
Hi, my name is Dr. Chinnaya Parimi, gastrointestinal surgeon here at Apollo Spectra Hospitals.
So, recently we are seeing a lot of young men and women who are constantly complaining of bloating, constipation, fissures, piles. Do you see a lot of people having these complaints now? Do you think there is an increased incidence of these problems in this generation of youth?
Definitely. Probably from the lifestyle modification compared to what our forefathers and our ancestors used to be in terms of decreased physical activity and increasing intake of the refined foods which don't uh, which are not conducive to adequate bowel function. I think all those are definitely contributing.
Which do you think is one food which definitely contributes to constipation?
Yeah, the patients keep asking me what foods should I avoid, and I generally don't like to give them a straight answer, especially because people love their food, and I don't want to take away the foods that they like away from them. Yes, we all like to have a cake once in a while, a pizza once in a while, but the most important thing I say is make sure you have enough fiber, make sure you're drinking enough water, make sure you're getting enough exercise. When you say fiber, what are we talking about? Ideally, all natural sources, fresh fruits, fresh vegetables, and whole grain foods, which is unprocessed grains, which is very new, even though it's the traditional Indian way for a long time before the whole polished rice and the maidas have taken over our diet. So, yes, I don't like to say you cannot eat this because if you eat this, you'll get constipated. No, I say like if you want a dessert once in a while, you can have it, but make sure enough fiber from good sources is there every day.
When we take food, like everybody is counting their protein, like how much protein I'm taking in a day, but nobody sees how much fiber they're having in a day. Is there a way to track their fiber intake?
Nowadays, everything is available online. We have all these apps which will tell you how much fiber is there in each food. It's hard to do. I don't do it. But the guidelines say you can have safely up to 25 to 35 grams of fiber every day. But the one thing I like to say is it generally does not work well when you start having problems. Yes, the gastroenterology guidelines of a lot of societies talk about starting treatment of these problems with first fiber supplementation and then seeing how this works. But they also acknowledge that a lot of people, when they start increasing the fiber, all of a sudden their bloating and
Bloating
constipation are
increase.
actually worse. So it's better to actually talk to a doctor and treat the symptoms first and then gradually increase the fiber content. But yes, there are ways to track it, but I would say it's hard to overdo the amount of fiber as long as you're taking it from natural sources. And but yes, 35 grams is the general guideline.
So if you are talking about foods that move the gut, what are the top three foods that you like?
In terms of good research, talking about natural foods, unfortunately, we don't have a whole lot. It's all Western research. And out of those, if you look at the natural fiber sources, kiwi fruit, especially along with prunes, are the ones which have the most evidence. But I don't like to limit our patient choices, especially we live in India, we don't live in the United States, to say, okay, this is what you need to get and like measure and eat. That doesn't work long term and it's actually not sustainable. So, yes, fruits are good. Fresh vegetables, salads are great. But that, along with a lot of water intake, almost none of us drink enough water. I would say at least 3 to 4 liters a day would be ideal. At least if you put that goal, you'll at least drink 2 liters. I think that's a good intake goal to start with.
And when it comes to pregnancy, we can't tolerate a lot of foods in the early pregnancy. And many people, due to progesterone, they have this slower bowel movements, and constipation is something we frequently see in early pregnancy. Is there any good way to handle this?
Um, Yeah, I do see patients coming from your team with this problem. Yes, it can be very challenging. The hyperemesis spectrum is very variable. Obviously, if you can, they need the fluid intake and they need the nutrition. And even using just simple protein drinks, if they are not able to get any of the natural sources, is okay, even though that's not ideal compared to the natural sources. But having said that, I believe using laxatives is much safer than what most of our culture lets it out to be. This is what I got from my teacher, Dr. Alberto Pena. He's a pediatric surgeon, pioneer of colorectal surgery, and all the fears of like use of laxatives as something dangerous our body will get used to is not really based in good science. Yes, abuse of any medication or any drug is possible, but with good physician guidance who is monitoring the patient and then helping them manage their symptoms, laxatives, basically medicines which help you have a regular bowel movement, can be extremely safe and can help patient get through these difficult times much easier than try to do all of it without any medical help.
So when you're talking about regular bowel movements, what is exactly regular?
Great question. Um, if you go to the criteria for functional bowel disorder diagnosis, like say Rome 4 criteria are one of the most commonly cited, it's a very strict classification. So you say like, okay, if you're having to strain more than 25% of the time that you have to go, or you only go to the bathroom less than 3 times a week, or say like looking at the stool characteristic Bristol criteria, it's like class 1 or 2, like really hard stuff, again more than 25% of the time. When I look at this criteria and try to ascertain how many of our patients actually fit that criteria, most of them don't. And the moment somebody has abdominal discomfort or bloating associated with even slight um, symptoms of altered bowel function, by most of the criteria, they automatically go into the irritable bowel syndrome group. And for the treatment algorithm for that will get much more complicated. But I tell my patients, you need to have an easy bowel movement without straining almost every day. Yes, do some people have a perfectly normal life even with less frequent bowel function than that? Yes, it happens. But the moment a patient tells me that they don't go to the bathroom to empty their bowels every day, my index of suspicion goes up that they might have more symptoms that they've learned to ignore over their life. But as long as they have no abdominal symptoms, meaning they have no bloating, they have no acidity, they have no discomfort, and every time they go to the bathroom, they feel like it goes very easy, it's considered normal. The criteria says at least 3 times a week, but I think that's too strict. I think it's better to for it to be more often than less often.
Many of my patients tell me that they try to pass stool every day and they spend at least half an hour, 45 minutes in the bathroom to do it. Do you think that's healthy?
No, it's not. People think that is part of normal bowel function, which is not true. Generally, it has to be done easily without straining within 15 minutes or so. Anything more than that can be causing other problems, like we say piles or hemorrhoids, which even can happen in people who do not have significant constipation if they just sit there straining, or they're reading a newspaper, or they're looking at the mobile phone, just distracted. Being in that position waiting is bad. I would say, please do everything else outside the bathroom. Go only when you really need to go. If nothing's happening, get up and walk away. And then come back when you really feel the urge. That's better.
Which do you think is better in this scenario, like using an Indian toilet or a Western toilet for people with chronic constipation?
The studies definitely say the Indian position is better. it's not easy for everybody to change their
Right.
commodes now, but now there are like additional squatting devices that
You can attach.
they're available to help people get into that position. Yeah, they definitely can help.
And what about those footstools that we can use with the Western toilet? Do you think that really helps?
It can help. Is it as good as Indian position? It's hard to say. I don't think that studies have ever been done or will be done. But like a lot of our older generation, like the moment they get to certain age, they're not even able to squat on the Indian toilets anymore. So that's not an option for everybody. And for them, definitely that's a good option.
So at least try with a footstool and see if that helps with your bowel movement.
Definitely, definitely.
And what do you, I mean, like routine in your practice? Would you suggest hot water, drinking hot water to improve the bowel movement?
I don't. The one thing is, I don't know that there is actual evidence. Like a lot of people in India believe in hot water. I think water intake is the most important. I love my cold water. Keep drinking my cool water. I would say the water intake overall has much more evidence than the temperature of the water.
And what about coffee, sir? Do you think coffee helps in people with constipation?
Coffee is definitely a known stimulant which can help people with constipation empty better, and especially there is now some evidence that it might even help fatty liver disease, but maybe that's more of a black coffee than the sugar rich milk coffee that most of us drink. But yes, it is a known stimulant which can help.
What is your view in having a coffee the minute they wake up so that it helps them pass their stool?
Caffeine and any of these other stimulants, it is a, I would say, there is not evidence to say that it is good for you overall, no matter what. A lot of people have issues with acidity, or like heart issues where like blood pressure is going up, or like some people even have like racing heart palpitations kind of thing just from stimulants like caffeine. So a universal blanket statement for everybody saying everybody drink coffee so that you don't have constipation, I think is not a good idea. But people who already love their coffee and they don't have any other reason why they should not have it, it's reasonable to use it for the bowel function.
On empty stomach, would you think that's advisable?
I'm not sure. There is in India, we have a very strong idea about the order in which things need to happen. Like we think, like yeah, and there is some evidence saying that what order you eat things leads to different levels of absorption. So sugars and things like that. You don't want to take the dessert or whatever on an empty stomach. That kind of evidence is there. But specifically, coffee on an empty stomach, does it cause more acidity and problems to people? I don't know that we have good evidence to say either way.
Pain when they're trying to pass motion is a very common complaint. Many women and many men also have this complaint. So when they have that pain, like what is the first thing they need to do?
They can come see a doctor. That's one option. Most often, this is from constipation, which leads to this problem called fissure, which is a tear in the anal canal. Anytime there is a problem near the anus, everybody says piles, which is a completely different condition, but they can coexist because both are caused by constipation. But the most important thing when you have a fissure and pain is to avoid having constipation. Like the stool should be soft every day for it to start healing.
So once they get a fissure, how long do you think it takes for it to get better if they're not using any medication?
It's hard to say. Some people without medicine, it might never heal. Especially the longer it goes, the longer it is to heal without any medication. And sometimes these get infected, turning into a fistula or an abscess. So I almost always recommend treatment medically, not surgery. Most of these patients don't need surgery, but there are ointments which can help. Warm water baths, which so-called sitz baths, will help, and laxatives definitely will help. That is the safest way, I believe. It is to heal these, and it is important to counsel the patients the importance of the constipation in causing this problem so that they understand and don't let it go on and come back again and again.
Many women with endometriosis have a lot of bloating and they also have painful stools. And this is not something they should ignore because this can be a sign of deep endometriosis. Do you regularly see women with endometriosis who come with fissures, fistulas, or other bowel dysfunction?
I think it's important to pay attention to what exactly the symptoms they're having, especially if they're having a lot of bloating and discomfort when they pass stool. Uh, in addition to evaluating with the imaging with like MRI or like ultrasounds, they might also need a sigmoidoscopy or a colonoscopy to look at their colon to make sure there is no endometriosis involving through the bowel wall. That's aside, if the fissure and the piles or the anal complaints come into the picture, most often that is related to the constipation end of the spectrum. It is not the endometriosis inside the abdomen, which is affecting the bowel, which directly can cause anal complaints. The way the anal complaints come is almost always because of the hard stool.
When women with bowel endometriosis they require shaving or they require a segmental resection, what symptoms they can expect after the surgery?
We expect their bowel symptoms to be completely resolved. Yes, some of the symptoms are not directly related to the mechanical problem of the endometrial implant on the intestine. So, even though we take that part of the bowel out or like cure that, um, endometriosis is a systemic condition, and whatever the impact of uh, the hormonal imbalance and that itself can cause with the intestine, those symptoms can persist to some extent. But any of the obstructive or bleeding kind of symptoms that you have from the bowel implant of the endometriosis should be gone. And after that, as long as you take care of the endometriosis medically and any functional bowel issues like constipation, you should have a normal life. It's not like you're losing so much intestine that somehow your life will be altered or your diet will be limited in any certain way.
So it might sound like a major surgery, but that surgery actually improves their quality of life.
Totally. And that is the reason to do the surgery.
Many women with PCOS have bloating. Is bloating something they have to be seriously concerned about? Is it related to just gut?
That's a good question. Um, in patients with bloating, they've tried to see and measure actually radiologically, meaning on X-rays or CT, they actually have more gas in the gut, and they always don't. The symptoms can be hard to define, but uh, I do believe a lot of women with the polycystic ovarian syndrome or PCOS have issues with hormonal imbalance and even insulin resistance and being overweight. And we don't know what causes what or if this is an association. But we do know that when these women exercise and improve their lifestyle, their PCOS symptoms can improve. And those are the same things which also help with their bloating and bowel complaints. And I do believe a lot of these patients, the bloating is from some level of constipation that is not fitting into the what we talked about textbook criteria of constipation yet.
So anti-inflammatory diets are the total craze right now. What is your view on that?
I think in patients with documented inflammatory bowel disease, obviously anti inflammatory diets are reasonable. They can be very restricting for people without such diagnoses. And I even like to specifically ask when somebody says, I'm taking an anti inflammatory diet or some other name they come up with, I ask for specifics because, like, what did the dietitian actually say you should eat instead of just using a term like that? because I think the details matter. And for most of the quote unquote normal people that we are talking about, uh, yes, avoiding the super processed, refined foods with high sugars, high salts, um, going as close to the basics as possible. Like some people like to say, if your grandmother doesn't recognize what you're eating or the ingredient list on what you're eating, you probably shouldn't be eating it. Um, that is the general guidelines I would go by, rather than any specific do's and don'ts about what you can and can't eat.
I'm a big fan of gluten-free diet. I have seen very good results for myself. I have had a lot of bloating for a couple of years. I've tried some food, but I've seen that being on a gluten-free diet has helped me a lot. I'm very happy. I'm very comfortable in my skin. I have lost a lot of weight, and I have better energy levels to say that.
You don't look like you should lose weight.
Thank you. But yeah, but I don't think weight is the only criteria, right? You have to be comfortable. When I eat something and it doesn't make me comfortable, what is the point of eating it?
Yes, that is a good way to think about it. But many times patients go on this journey of trying to figure out what foods agree with them and what foods don't. And I'm glad you found your answer and able to tailor your lifestyle around it. But some people are not so successful, especially because there is a delay between what you're taking and how it's affecting your body. And sometimes the symptoms are not that immediate. And so your body could be reacting now to what you had a week ago. Or there might be some other underlying condition that we might be able to help. So take the help of your doctor, see them and discuss the symptoms and figure out what can help. Yes, does everybody need an endoscopy? No, especially if you're young and the likelihood of serious conditions is low, and there are no warning symptoms, which are like bleeding or something like that. Most people don't need an endoscopy. But yes, if you're able to figure out the specific foods that don't agree with you and you're able to live without them easily, that's fine. But most often, we are able to find some other explanation which can let you have most of all the foods as long as you take care of the actual problem. So please depend on your doctor.
Malasana is something that I suggest to most of my patients who have constipation. So, what is one exercise that you really like telling your patients to follow?
I don't recommend any one particular exercise, but the whole cardiac workouts where somebody is exerting themselves enough, where they're either sweating or getting short of breath to some extent, is the guideline for overall health. It is hard for most of our patients to feel like they have enough time to exercise. They say, "Oh, I was too busy with work or like kids or something." So it is hard to have a different workout for every single part of our health. But any cardiac workout like walking or running or swimming or cycling is known to help with our gut, our heart, our lungs, our fatty liver. All these are conditions that are like labeled separately, but if you look at whatever the metabolic syndrome or like fatty liver or diabetes or high blood pressure, the aerobic activity where you are actually exerting yourself. If you want a heart rate monitor, put on a heart rate monitor to see if your heart rate is going high enough. If you are like super relaxed, walking slowly in the evenings, does it really count as aerobic activity? Maybe not enough. But as long as you do enough of that, I think it'll help your whole body, including constipation.
Do you think there are any specific abdominal exercise where you put pressure on the abdomen and that helps in the, getting the bloating down?
Not that I know of. But seriously, you can actually, if you feel like something that you know that you're like, you're happy to see, you can say it.
I usually do suggest cat force and cow force for many of my pregnant patients. It helps a lot in getting the gas out. And if you're not pregnant, I would say crunches is a good way too. That helps a lot with bloating as well.
Sure, I don't see any reason not to do it. We use it even in babies. The positioning the baby that
Yeah.
way helps. So it makes sense that it would help adults too.
And talking about fatty liver, I think we see that in almost 80% of our ultrasound reports. What stage of fatty liver is something that people need to be concerned about? How frequently do you see this fatty liver in an ultrasound report?
These days, in our socioeconomic class of patients, I would say it's more than 80%, maybe 90%. But ultrasound is not actually a great way to categorize and classify fatty liver. What we call liver elastography is much more sensitive. Does everybody need it? Maybe not. If you have any abnormality in your liver function tests, like when you do the enzymes and they are a little abnormal, that's much more concerning. Um, but it is more of a reminder for us to say, okay, you are pre-diabetic, or like you have early fatty liver disease. All of these are pointing to the same thing.
That's right.
You need a better diet exercise balance. You're taking too many calories and you're not spending them enough. And as long as you take that message home and just use a weighing scale at home, that's a better way to follow it than doing an ultrasound every 3 months. Um, and as long as you change the lifestyle enough, the screening tests are worth it.
So, if somebody has fatty liver on their ultrasound, how many kgs of weight they need to lose? What would you usually suggest to your patients?
Yeah, I wish there was a simple metric like that, and it doesn't exist. One of my close friends, Dr. Gattu, is a researcher in Boston on metabolic diseases, and his main area of focus is the so-called lean diabetics, which is a lot of the South Asian population. People can be thin, people might not be overweight, but they can still have all the hallmarks of this metabolic syndrome: fatty liver disease, diabetes, high blood pressure. So we have to build muscle and we have to lose the fat. So both of them have to go together. Yes, if you see somebody who are obviously obese by appearance or BMI standards, and you know that it is a lot of it is fat and not muscle, then you can give obvious, clear goals to say you can lose this much
Yeah.
weight, and that's helpful. But it is important for people to know that building muscle, actually taking the protein recommended along with exercising to build the muscle, is as important as just shedding weight. You can talk about the newer medications that are coming out, the Wegovy's and Mounjaros that people are using. And if you don't use those without adequate care, where you are actually building muscle, they can make you lose your muscle along with the fat, and which is not good for you. So it's not just about shedding kilos. It is, yes, you can measure that, and that is helpful, but building muscle, maintaining muscle mass is as important, if not more, while you're shedding the excess weight.
So even if you are lean, if you are overweight, if you are obese, you still need to exercise. It doesn't matter what is your weight or what is your BMI, having a regular physical activity will help you over the long run. If you're talking about these weight loss injections that are happening a lot these days, like Wegovy, Ozempic, or Mounjaro, like what is your view? What should patients watch for when they're taking these medicines?
Um, I would say they have been a boon for a lot of patients. They initially came out as diabetes treatments, but I've noticed that people are losing their excess weight, and people have found remarkable benefit with their overall metabolic function. But having said that, yes, it is important to make sure that you are taking a good enough diet while maintaining your muscle mass when you are taking these medications. And so you should never do this without proper guidance from your physician and dietitian, and maybe even a physical trainer. A lot of people were thinking about weight loss surgery before these drugs came out. I have done weight loss surgery to so-called bariatric surgery, where we do gastric bypass. So obviously, in the United States and most of the West, introduction of these drugs has brought down the number of people looking for surgery, which I think is great. But having said that, it is important for you to focus on an overall balanced weight loss approach. You can None of these are a silver bullet. Like, you can't just take an injection and assume that everything will be fine. They're a great tool. These so-called GLP-1 agonists decrease your cravings, decrease your appetite, which can help you on a journey towards healthier you. But nothing happens without the actual diet modification, without the actual exercise, in terms of becoming that healthier you. It is still a complete package.
So you still need to exercise even if you have had a bariatric surgery, or if you are going for weight loss injections, or you're trying to get fit naturally, exercise is still going to be a part of your lifestyle. So if somebody is taking these weight loss injections like Wegovy or Ozempic or Mounjaro, what side effects they can expect?
Most of the side effects people are complaining about are actually expected medication effects, which are like loss of appetite, or feeling a little bloated because their stomach emptying slows down, or even nausea. Some people can find those symptoms disabling enough that they actually have to stop the medication. And that's a decision they can make with the doctor, whoever has prescribed it to them. There are reports of rarely some reports of patients having these symptoms persistently even after stopping these medications. So it is important to take the decision to starting any newer medication like this lightly. You have to consider all the options, and again, incorporate as much of the healthy lifestyle into your day-to-day routine, and if really necessary, compared to most of the other medical options we have had before, these medications are helping a lot of people, but yes, they have side effects.
So don't take these injections lightly. Talk to a certified doctor before you start these injections. Watch for your symptoms. Get back to your doctor. Discuss with them. Maybe lowering your dose or changing the formulation might help, but do it under a doctor's supervision.